Good morning. Today we're going to talk more about managing PAWS symptoms. So, looking at Staying Sober by Gorski and Miller and their chapter on managing PAWS symptoms. And we'll go over the first few today and then talk some more tomorrow about some of the rest. So, reading a couple of things they say. The less you do to strengthen yourself against an episode of post-acute withdrawal, the weaker your resistance becomes. It's like a tetanus shot. The longer it's been since you've had one, the more risk there is that you will become seriously ill if you cut yourself from a rusty piece of metal. Conditions that put you in high risk of experiencing post-acute withdrawal symptoms are usually lack of care of yourself and lack of attention to your sobriety program. If you are going to recover without relapse, you need to be aware of stressful situations in your life that can increase your risk of experiencing PAWS. Since you cannot remove yourself from all stressful situations, you need to prepare yourself to handle them when they occur. It is not the situation that makes you go to pieces. It is your reaction to the situation. And I'll stop right there because I, in my addiction, used to blame situations and the people involved in those situations on the amount of stress that I would feel and on the resulting breakdowns that I would often experience. I would crack under intense stress in a way that other people didn't. Other people seem to be able to slog through very stressful situations, for instance, having to pull an all-nighter at work. Where I might crack under that pressure and not be able to work the next day. And part of that was due to the amount of alcohol and drugs I was using, and another part of it was due to my inability to look at those situations and manage my stress rather than blaming the situations and the people involved. So that line is very important to me. It is not the situation that makes you go to pieces. It is your reaction to the situation. Because stress triggers and intensifies the symptoms of post-acute withdrawal, PAWS can be controlled by learning to manage stress. So this has been a huge part of my recovery. Learning to manage stress. Figuring out how do I deal with the things that used to make me fall apart in my addiction. The things that used to make me fall apart in my addiction are the things that drove me to that addiction, drove me to the drugs and alcohol. And so how do I manage those things? If I look back on my addiction, the times when I was able to keep my drinking controlled, the times when I was able to keep my drug use somewhat controlled, were the times where things were going okay, and when there wasn't a lot of stress. It's when the stress kicked up, when, crap really hit the fan, that I found myself overindulging time and time again, and more than overindulging, just getting completely inundated with drugs and alcohol in order to deal with the stress. And so a big part of my recovery has been learning how to handle stress, learning how to deal with it in a healthy way rather than by bottling it up and not really having a way to deal with it. So one of the first things they talk about is if you're experiencing post-acute withdrawal symptoms, it is important to bring them under control as soon as possible. Suggestions that they have, and these are a huge part of my recovery. First is verbalization. Start talking to people who are not going to accuse, criticize, or minimize. You need to talk about what you're experiencing. This is huge, and this is why it's so important for us to build a recovery network of people we can talk to. This is also why in a program like AA, a sponsor is such an important person. You need someone and people that you can talk to that won't criticize, accuse, or minimize what you're feeling. You really need people who understand what you're feeling. And I am so fortunate to have those people. I've got my good buddy who I was roommates with at the rehabilitation center I went to. We both arrived the same day, and we're now both over a year and 3 months into our recovery, and we're able to talk to each other about the crap we deal with in life. And he's able to, when I'm kind of going off the rails, he's able to help see what I'm going through and help me see what the right next steps are for me to take, without criticizing me, without minimizing anything that I'm going through, without accusing me of doing anything wrong. Just help me see the right way forward. And those are the kind of people we need in our recovery. We also need people that we can vent to. So ventilation is another technique they talk about, and that's expressing as much as you can about what you are thinking and feeling, even if it seems irrational and unfounded. And my wife is great at listening to me when I need somebody to ventilate to, and I'll go to her and I say, I got to bounce this off of you. And I'll tell her how I'm feeling. And 9 times out of 10, she says, I totally understand where you're coming from. And just knowing that I'm not going crazy, that, what I'm saying, what I'm feeling makes sense to someone else, is a huge stress relief. And once I relieve that stress and remove that stress, then all of a sudden trying to think through what's the next right thing to do about this situation becomes easier, and finding that answer is a little bit, it's a little bit clearer what that answer should be. And that gets into reality testing, where they say you should ask someone if you're making sense, not just what you're saying, but also your behavior. Your perception of what is going on may be very different from reality. This is another important thing for us to realize. Sometimes what we perceive in the moment is different than what's actually happening. So we may see a situation and feel attacked when an outsider looks at that and says, no, I don't see that as what's happening. We need people that we can talk to test that with, and to make sure that we're not overblowing something or making ourselves the center of a situation when really there's a lot of other things going on. And finally, they talk about problem solving and goal setting. What are you going to do right now about what's going on? You can choose to take action to change things. This has become really important for me because I would dwell on all of the things that were driving stress in my life and just get bogged down in them and wallow in self-pity and remorse and build resentment. But I wouldn't really think about what am I going to do about it? What am I going to do about it right now? I'd think about things like, well, next time I see this person, I'm going to tell them off. But what am I going to do right now, right this second? And that's the kind of thinking that we need. What is the next right thing to do in this situation? And a lot of times, it's just let it go for now. A lot of times, if I feel upset with someone, the right thing to do is for me to say, well, you know what? I'm upset right this second. I'm going to step away from this situation for a little bit and just let my mind kind of do its thing and not be upset with them and see how I feel tomorrow morning. A lot of times I wake up the next morning and I see the situation in a different way that I would not have seen it if I had held on to that upset and formed a resentment out of it. And I see it from a different light than I would have if I had been building resentments and wallowing in self-pity about the situation. So those are some of the biggest ways that we can manage stress when we're dealing with PAWS, when we're dealing with any kind of stress in sobriety. And it's really important to start to use those tools as a way to not only manage stress but prevent stress. These are tools that we can use to prevent the kind of stressful situations that we often found ourselves in our addiction, and that often drove us to use and to drink. And if we are able to use these tools, it will dramatically decrease decrease the likelihood that relapse becomes a part of our recovery story. And that's the goal here. You know, if we want to say that our goal is to avoid relapse, then these are the tools we need to become familiar with and start using in order to do that. So tomorrow we'll talk a little bit more about some of the other tools that they mention. I'm skipping over a couple. For instance, nutrition is very important. Healthy sleep is very important. But I really wanted to talk about these communication and expression strategies because for me, those are the most challenging things to learn, and they've been the most effective ways of dealing with the kind of stress that I used to have often in my life, in my addiction. Hope you all have a wonderful day, and I'll see you back here tomorrow morning.